I think qualified MHWPs bring a really unique set of skills to a team, and I actually think it's a really, really valuable role. Firstly, I would say obviously it brings low intensity CBT interventions. The reason that I think that is important, or it is important, is that it really helps people transition into psychological therapy. It helps people sometimes transition into discharge. I think we see more and more often we have an influx of clients within mental health teams, but not a lot of interventions. It's always booking people in 4 weeks, 6 weeks. MHWPs can offer those interventions and quicker, and so we have quicker access to those psychological therapies. Additionally, I think as well, it brings a sense of maybe a bit more psychology into the team. We can have those psychological discussions in MDT. So overall, I think they bring a really, really unique set of skills that's really, really valuable, really, within the mental health services.
I think what I bring to the team is a different perspective. It's the perspective of, I suppose it's the psychological background that came from the training at UCL that kind of brought this on, but it's looking at the client as a person. That kind of second story perspective, I think, is what I bring to the team, and that comes out a lot in sort of MDT settings where we might be discussing a client for 30 minutes, looking at the medication, looking at sort of the history, what teams have been involved, and then I'll kind of talk about the client in regards to the work that we've been doing. And the work that we do is very much recovery based, looking forward to what are the things they used to do that they can't do anymore, that we can perhaps rearrange and do in a different way, that kind of is adaptive to their skills now. And that kind of approach, bringing that into the MDT, I think a lot of the time it's brought a more hopeful insight into what the client can do. It's really challenged problem-saturated conversations within the team. So I think that's definitely something I've brought.
I think it would be really good for whoever is planning the workforce for the NHS to consider more MHWPs for different teams, not just secondary care teams, but across the board. I think that the workforce generally has a lot to offer in terms of skill set. We all come from different backgrounds and that brings its individual qualities, but I think also the training course itself embeds skills in teams which are transferable across professions, and it means that we have more to give to people because our skills aren't just for service users, they can be used in other ways, and we can, work with other staff, do some joint working to bring those skills into place into different areas. Ideally, they should be seen as their own workforce in the same way that a nurse is seen as a nurse and an OT is seen as an OT. An MHWP is a workforce.